Today's program is about the medical care transgender kids receive. We're publishing this podcast at the beginning of June 2022, and as we do, 15 states have either restricted access to gender-affirming care or are considering laws that would do so. These figures come from the Williams Institute at the UCLA School of Law. 6 states also include penalties for parents who seek out gender-affirming health care for their children, and such efforts are being classified as child abuse in some places. Insurance companies are being barred from paying for this health care, and close to 60,000 transgender youth are at risk for losing access to health care because of state bans and policies. That's the backdrop for this episode. Since recommended healthcare is being criminalized around the country, we wanted to know what the accepted standards of care are when it comes to assessing and treating pediatric patients whose gender expression is different from what was assigned at birth. For pediatricians and endocrinologists and behavioral health and family care specialists, what are the accepted standards for treating trans kids? And along the way, we'll hear some stories from trans kids themselves and the people who love them. Because if we're certain of anything, we're certain that those stories matter. Coming to understand yourself.
I very vividly remember being always slightly uncomfortable. Felt like I was acting in a role of being a girl.
I remember cleaning out his older brother's closet. And I remember him going through the bin and pulling out his older brother's stuff. And I kept saying, you have your own clothes, you don't need his hand-me-downs. And that's what he wanted to wear.
Yeah, and he would have been all of, 2, 3? Yeah, that's my first memory too, is him insisting that he wanted to wear boys' clothing, and in particular boys' underwear. That always stood out because it's private, right? It's not like it's about your public presentation.
Right.
A lot of it is, at the beginning, listening to the family, validating their experience, letting them know that this is normal. It's very normal for children to think about their gender and to explore their gender. You don't need to do a lot of things otherwise, but allow them to be who they want to be.
Coming up, the standards of care for trans kids on the Hear Me Now podcast that comes to you from the Providence Institute for Human Caring. I'm glad you're listening. Stay with us. Hey everybody, I'm Sean Collins. This episode of the podcast is multifaceted, and because of that, I want to give you a little bit of a roadmap of what to expect and where you can go for additional information. What you're listening to now is the main edition of the podcast, and coming up, I'll be talking with clinicians about gender-affirming care as healthcare. But alongside of this main podcast, we're also publishing bonus audio files that you can listen to at your leisure. Longer conversations between people who have some experience with the issues healthcare for trans and non-binary people pose. You'll hear from trans kids, for instance, and youths. You'll hear parents talking about raising a trans child alongside of cisgender siblings. We've excerpted some of these bonus conversations to play back for our clinicians to hear and comment upon on this main edition of the podcast. So you'll hear small excerpts from those longer conversations. But if you want to hear the whole conversation, we've published that alongside and you can go and listen to it. And we encourage you to. You'll find these bonus conversations on our website, hearmenowpodcast.org, and you'll probably also see them published alongside of this main podcast episode on whatever aggregator you use to sort your podcasts. Confused yet? Sorry. Bottom line, go to hearmenowpodcast.org and you'll find it all neatly arranged. And there really is a treasure trove of stories waiting for you to explore. We've also included a list of resources having to do with trans plus healthcare, and we've included a glossary too if you're not completely familiar with terms that are being used in the conversations. So let's get started. I'm really happy to introduce our guests for this episode, three folks with a wealth of experience. Ponrat Pakpreo is a pediatrician focusing on adolescent health. She practices at the Providence Medical Group in Spokane, Washington. Marcy Drury Brown is a pediatric endocrinologist at Providence St. Vincent Medical Center in Portland. And Bentley Moses is the Senior Program Manager for the Providence Institute for Human Caring's Trans Plus Health Initiative. I am so glad the three of you are with me today. Welcome, all three of you.
Thank you so much, Sean.
Thank you for inviting us.
Thank you.
So can someone start us off by describing for us how you begin to evaluate a young child, who you're seeing, and who says that their gender is not what they were assigned at birth?
Well, Sean, I can jump in and talk a little bit about that.
This is Dr. Marcy Brown in Portland.
Yes. So as a pediatric endocrinologist, these children get referred to me to help the parents really begin to process what's going on with their child. I may not be providing any specific medical treatment per se, but a lot of times it's talking with the parents and talking with the child and beginning to develop rapport with them. For the family, a lot of times it's not something they anticipated or necessarily expected. Although in some cases they can say, you know, my child has always said this. From the time that they could name their gender, they have told me that their gender is this. And for some, it's something that's really developing. And so a lot of it is at the beginning, listening to the family, validating their experience, and letting them know that this is normal. It's very normal for children to think about their gender and to explore their gender. And so at a young age, like 4 or 5 or 6, you just let them explore their gender. You don't need to do a lot of things otherwise, but allow them to be who they want to be. And so if a child is very insistent that they are called a certain name or they get to wear certain clothes, that's okay. It's okay to allow that to happen and let them know that all they need to do is support and love their child, and they'll work through it. You know, you can certainly get them involved with like a child psychologist who can also talk with the child and talk with the family and provide support for that. A lot of times there can be issues with the school or maybe with other people in the family. So it's helpful for the family to get resources on how to navigate those situations. But it's not about trying to tell the child who they are or aren't. It's about accepting the child for who they are.
Right. Dr. Pakpreo?
Yeah, most of my patients that I see are older children, so 11 to 12. Average age is probably more like 14 or 15. And many of them will tell me that I have felt different since I was a young child, but I could never find the words. I just knew I was different. I don't know how to describe it. I couldn't tell anybody because I didn't really get it. So I just carried on with my life. But as I've gotten older, I realize I'm different, and then they find the words to describe how they feel about their gender. And so it is a conversation. And oftentimes by the time they see me, it's a conversation that they've had with their primary care provider, their pediatrician or family practice doc, and sometimes with their families. But that's not always the case. Sometimes these kids come to me, which is slightly awkward, for a discussion about gender dysphoria, but the parent doesn't know. So it can be quite an interesting visit, but we usually get permission from the child to start exploring some of these issues during the visit so we can have a meaningful conversation with the parents.
What do you do in that instance? How do you bring this topic up with parents who perhaps have suspected something and not said anything, or weren't willing to bring it up with their doctor? How do you broach the subject? How do you bring it up?
Well, we start with the referral first. And if we get any kind of hint that they have not disclosed to their parents, and so to understand what the referral's for, we go back to the primary and say, hey, have you spoken to this child, this patient, about why you're referring them to me? and how they want to bring up the topic. And so sometimes they'll actually call the patient themselves first to say, hey, how do we talk about this so your parent understands why you're going to go see this adolescent medicine doctor? Other times when they are in the visit and they have not disclosed to their parents, I'll have a separate private conversation with them to talk about how do you want to do this. And some kids don't want to disclose to their parents for quite a while. And so we don't use their preferred name or their preferred pronoun with the parent in the room. But when they're not in the room, they ask me to use their preferred name and their pronoun, which is fine. I do my best. And but talk about kind of how do we talk to your parents about this? First, it's how are you doing? And then how do we bring your parents into this conversation so we can kind of move forward? And it can take a couple of visits.
Bentley Moses?
I want to comment just on Dr. Peck-Prio's just way that you have worked with patients in caring for them in the way that's empowering for them. You brought up, using a patient's preferred names and pronouns in one setting, and then, their given name and pronouns in another setting. And I think that way of caring for patients is something that's really emerging, this awareness that people's process is really personal, and empowering people in their healthcare setting to follow that path in the way that's right for them, and trusting that trans patients, trans people know what they need, and that even if it's not a linear process, even if it's something that might be a longer process, or you might need to make a decision and wait a little while to think about it, having providers really give patients all of the tools and all of the options and empower them to make those decisions themselves is something I'm seeing more and more in healthcare. And I'm really excited about that. I think that feels empowering for patients, and it feels empowering to respect what a patient really needs to be their best self through healthcare interventions and through that process.
Yeah, it strikes me that is true both for adult patients, but also for pediatric and adolescent patients.
It's the same thing, yeah.
To have your identity honored in that way, it may be the first time or one of the first times that they've encountered that outside of a very small circle of trusted friends.
Yeah, I would agree with that actually. And it's interesting to me that some of the adolescents that I see who have been seeing therapists for a long time haven't actually even told their therapist. And being in a setting where they feel comfortable to drive the agenda and guide the process and be the person to say, hey, this is when I want to disclose, this is how I want to disclose. Being the first person they talk to about it is quite a privilege. And I just want to add, so when we talk about disclosure to parents, sometimes the kids will ask me to have that conversation with the parent in the room with them. But at other times, we'll talk about how to do it at home, and they'll set the timing and the setting and to do at home and have the support people they want around them when they decide to do it. But it is a very brave and vulnerable thing to do.
Yeah, well, awesome to be trusted with those disclosures, Dr. Peck-Prio. Ponrat Peck-Prio is an adolescent medicine physician in Spokane. We also are talking with Bentley Moses, who's the senior program manager for the Trans Plus Health Initiative here at the Providence Institute for Human Caring. And joining us from Portland is Marcy Brown, a pediatric endocrinologist at the Providence St. Vincent Medical Center. We're talking about gender-affirming care for transgender kids. Over the last couple months, in preparation for this episode, we've sought out individuals who have a particular story to tell about their transition when they were young, and the way it happened, and the things that helped them, the things that hindered them. The first excerpt that we want to play is from a conversation between Erin and Sam. Erin is the mother of Sam, who is a 19-year-old trans man. Erin tells us about a phone call that she received years ago from Sam's fourth grade teacher.
She said, just wanted to let you know that Sam seems to have been having a hard time, and broke into tears in the middle of sex ed today and didn't really know why, and just wanted to help me be aware And I tried to talk with you after school, but you were very, very private. There was not sort of a way in. Clearly, it was upsetting to you. And it wasn't until years later that I realized, like, oh, no wonder that was so upsetting to Sam, because there probably was a sense for you that you did not fit in these categories that you were supposed to be in.
And at that time, like, there was no talk at all of, it was kind of weird, like, being the age that I am, because it's half of my life is set in the ways of like early 90s sex education and things like that, and like health classes, and like discussing, there was no such thing as discussing trans queer topics, queer sex, like how to have safe queer sex. There was nothing like that. It was like very old school, like textbook, which is wrong, really very wrong. And like, I'm not even sure that that's changed, but I remember like growing older and being in high school, it changed a little bit, but I was always advocating for myself and advocating for that change, but didn't really know how to, because I was so scared, being like really one of the only queer kids that I knew, like in my immediate circle or like at the school. It's pretty few and far between, like growing up in Montana. I very vividly remember like just being always slightly uncomfortable. For me, it felt like I was like acting in a role of being a girl. Like it never really was quite there. And I was just kind of like feeding off of what other people around me were doing. And like, it's a little bit like I was like a sociopath, like trying to figure out human emotions, but I was just trying to figure out how to be a girl and doing really bad at it because I was not. And I was like, just, that was not who I was. Like, but I was friends with all these girls and loved them and like wanted to talk to them. And I still am friends with mostly women because I feel so comfortable being that way. And I think I express myself in a pretty feminine way now, just from growing up, being put into that box of being a girl. And I don't like completely, I think that a lot of trans people, not saying that this is wrong in any way, because there's no right way to be trans or express your feelings, but I don't completely disconnect myself from that. Like there was a point where I presented as a girl, not that I was one, but that's a very important part of my life is like, I went through girlhood and like I had hard times, like, like I experienced sexism and in those ways, and like had the very kind of a little bit like typical like mom and daughter relationship of like talking about like getting your period for the first time or getting your like first care package with a tampon or whatever. But it was just like really hard for me because I felt so uncomfortable. So I completely shut you out like as a mom. And I think I just took it out on you. I think that's kind of what a lot of girls go through.
The big issue I remember was every time we went on a vacation or something and you'd have to have a bathing suit to go to the beach or something. That just was such a trigger for you. And it was so challenging to try and find the right clothes for you. And, now, of course, looking back, I can look at that and see, well, of course, nothing felt right because it was the wrong thing. Now it makes sense.
That's Erin Pelger talking with her son, Sam. You can hear the rest of their conversation on our website, hearmenowpodcast.org. These conversations today are being archived at the American Folklife Center at the Library of Congress. Turning back to our guests, what do you all hear in that exchange between a mother and son? Dr. Brown?
I would say a little bit of hindsight is 2020, and that is really common. But when parents look back, they can start to see things. Oh, well, now this makes more sense. And the mom certainly verbalizes that really well. And I really appreciated what Sam said about, honoring his history. His history included girlhood, as he said. And so he understands some aspects of that. And it's a part of his life. And he doesn't want to, I think, necessarily negate those years. Those are valuable years in many ways, even if he wasn't at that time able to live as he really is. But that concept of being able to be his affirmed self, sounds so much happier, but also being able to value his overall life, I think is really insightful.
Yeah, I agree with you. So often you hear people use metaphors of journey when talking about their life, and he seems to be honoring part of that journey.
Exactly. Yeah.
I love that, in that journey, while I'm sure for Sam, there were a lot of things that were confusing or unclear, or, I think Sam kind of alluded to there's, being in class and there is no example, there's no model, there's no like image that you can look at and be like, this is me. And yet Sam knew who Sam was, and those threads of that are already there in Sam's story from a pretty young age. And Sam's reaction to that class, or the way that Sam was feeling, is different. And, we say different a lot because I feel like there's like often no other word to describe how complex it feels to be you and be trans in a world where those models aren't always the center of a conversation, or the examples we have at school, or the people that we grew up around. And yet, Sam is very, very adamant that Sam knew who Sam was. And there's difficulties in that journey, but I just love how like affirming that is too, to remember that even in hindsight, you can look back and say, yeah, that was always there. Even if it was a little messy to kind of get where I was going, it was always there.
What I heard from Mom during that conversation was love. I heard a lot of love in her voice, but I also heard uncertainty and bewilderment during Sam's adolescence. What's going on? I don't understand what this is. And for probably both of them being unable to articulate what that bewilderment was, how can we make this better, but not really understanding what it was that needed to be better.
I think a really poignant moment in that excerpt that we heard was when Sam basically said, and I took it out on you, Mom. And there was a sort of brutal honesty to that you don't hear a lot of 19-year-olds sort of own up to it. And I was just impressed by it. I want to play another piece of tape for you. This is Holly and Evie. Holly is the mother of Evie, who is a 14-year-old trans girl. She transitioned when she was 7, and she sat down with her mom and talked about that transition.
Do you remember in your first grade classroom what happened, what we did?
Mm-hmm.
So we read the book, I Am Jazz. Remember your teacher read I Am Jazz?
Oh, yeah.
And then we had a conversation about the word identify.
Identify.
Which I don't think that should even be a conversation now, because identify kind of almost invalidates who you actually are. All I remember at the time was one girl raised her hand and she said, well, I'm a girl and lots of people think that only boys can like Minecraft, but I like Minecraft. Do you remember that?
I don't remember that.
And a boy, I think it was Nathan, raised his hand and said, hey, I like Minecraft too. And he pointed at his Minecraft shirt. And then that's what it became about. The first graders didn't care.
See, it proves that homophobia and transphobia is taught.
Yeah.
It's learned from the parents.
Yeah.
So if you don't raise your kids in a hateful environment, they won't be homophobic or transphobic or racist.
Yeah.
There'll always be those like implicit biases, but as long as you don't actively teach them that white people are the best, or that cisgender hetero people are the only right way to be, they will be accepting.
Yeah.
Because that's the first thing that they learn.
Yeah.
First thing they should learn. But then again, I'm biased, and I understand that everyone has different beliefs, but I just personally cannot agree with someone.
Well, but I mean, everybody has the right to exist as they are, as who they are.
And that's what we believe. And
but I mean...
Some people don't believe that.
Well, but you're right, though. It's taught, and when it was taught in your first grade classroom that everybody has a different identity and has a way, of being who they are, everybody could accept it. And then those 3 kids who did bully you weren't in your class. They hadn't been a part of that conversation, right?
Mm-hmm.
But then it's like those kids kind of left you alone too, right?
Yeah, except the one girl, the other one.
Oh, okay.
She, the next year in 2nd grade after I transitioned, was sitting with her friend, pointed at me and said, "That's a boy."
Oh. Mm-hmm.
And was like, "I want to sit next to dead name. I want to sit next to him."
Oh. Mm-hmm.
And she looked at me when she said it. She knew what she was doing. Mm-hmm. And it just made me angry. Mm-hmm. So I almost burst a blood vessel.
Mm-hmm. What did it mean to you to get to change your name and gender legally?
It was just, for me, one step closer to becoming a, quote unquote, normal girl.
So we went to court, and there was like probably 40 people in the courtroom. So the judge comes in, sweeps into the room in his robe and sits down and basically reads us the riot act, says that a 7-year-old shouldn't dictate to the court what their life should be like. A 7-year-old can't possibly know what their gender is. And we had a doctor's note, which we had been told, this is what you need to change the gender marker. So we brought the doctor's note in with the exact wording that we had been told she should do. She had signed it. And he said, well, I can't admit this. This isn't evidence. And I was like, well, this is what we've been told to do. Well, that's hearsay.
Didn't it take a total of 2 years?
Yeah, it took 2 years for your name to find it. And then we got another attorney because our other attorney went on a leave of absence. And she filed in a different county with your new legal name and then just asked for the gender marker. And it was so easy. And it was like no issue at all with the judge who just signed your gender marker change.
Yeah.
That was the worst.
It's Holly and Evie talking about some of the steps in Evie's gender transition 7 years ago. You can hear more of their story on our website, hearmenowpodcast.org. Let's talk about this issue that the judge brings up. Can a kid know themselves well enough to start a transition or start the course towards a transition? Is it possible for a young person to know themselves? I think a lot of critics would say, no, they can't. Kids can't be trusted. You can't believe what a little kid wants. And clearly, almost everyone that we've heard from in the storytelling project has told us otherwise, that they were young and they knew what was going on. They knew something was different. They may have lacked the language to describe it, but they knew that they were different.
Well, Sean, I'll go ahead and start with that one.
This is Dr. Marcy Brown.
I really find the question to be a double standard, because what people question what a child who identifies as their assigned gender at birth, they don't question whether they can tell what their gender identity is. It's assumed that they know what their gender identity is and that it's fine because it aligns with what was assigned at birth. But if they can know what their gender identity is, then why shouldn't any other child with whatever gender identity know what their gender identity is? So there's a double standard there in that we allow it if it's for those who fall along the socially accepted route. But if somebody is not quite along that route, then we question it. And so I'm going to call that out as a double standard, which it is. But then we can go back to developmental, pediatrics and, do kids know gender, know their gender identity? Yes, they do. They understand that at a very young age and can speak to it. And there's plenty of examples of that, but it's understood within the developmental frame that they understand that. And that kids in that early school age will experiment with their gender and with their gender expression. And that's a normal part of development as well. And so we should be able to allow all of that.
I would agree with that.
Dr. Bach-Preo.
There's a lot to childhood and adolescent development that's dynamic. And I think one of the most important roles for parents to have is to support along the way. Nothing is ever written in stone, and everybody has a different trajectory, and we need to have that space to kind of figure out who we are and to articulate the words that are different. And I'm actually struck between these two stories of different school environments that fostered finding the words to say who I am versus, a school environment that just was very binary, either or, and I don't know where I fit in. And so, very much more positive experience, I think, in the second story.
Bentley Moses, what do you make of Evie's story?
Evie is so self-aware. I mean, and everything that Evie is sharing in that story, it's just striking how self-aware Evie is and how aware Evie is of other people and what they're going through. And I just was really, uplifted by how clear Evie is about how Evie understands the world, what is happening for other people and what they might be going through, and Evie's courage and conviction about what's right and what makes sense. And I think that, Evie talking very clearly about what Evie's experience was, knowing who Evie is and how they wanted to express their gender identity. Most people, if you ask them, like, when was the first time you knew you had this aspect of your personality or you were this person, they'll tell you it was very young. I've always liked this thing, or I've always been this person. I've always, if you ask somebody, when was the first time you knew you were a man or a woman, if you're cisgendered, most people won't even think about it. They won't, well, always. It just always was. And I think that's what comes out in Evie's story is, Evie's always, it always was. And something that jumped out in Evie's story too was just how different it can be being one county over from a different and I can speak from personal experience, having had a very similar experience, in the state that I'm in, and how challenging that can be to be vulnerable and know what you need and know what you want and to do all of the things that are externally imposed upon you to validate your identity and still have someone tell you no, and then to walk across a line and have that community tell you yes. Really affirming and wonderful that Evie had access to that other county, and really difficult that these sort of invisible lines made it more challenging for Evie.
Yeah, the lines we draw are kind of insidious. I want to shift a little bit and talk about the standards of care. For the two of you who are physicians, if you could help me understand, in the pediatric community and the endocrinology community, what are the sort of standards of care, the clinical guidelines for treating pediatric patients who come with some gender identity issue that needs attention? And I'll tell you what my ulterior motive in asking the question is. There's a lot of criticism in the public sphere at the moment in state legislatures, school boards, and other places where specific aspects of medical care for pediatric patients in transition are being criticized. And I want to understand the bigger picture. Like, what is the standard of care, and where do these things that are criticized, where do they fit?
So the standards of care, I think there's two, at least when I think about them, there's two main standards. There's the WPATH standards, so the World Professionals Association for Transgender Health has their standards of care. They're version 7. We're waiting for version 8 to come out. It's supposed to come out this spring, and so we're waiting for that next set to come out. And then specifically from an endocrine standpoint, the Endocrine Society, in conjunction with the Pediatric Endocrine Society, the European Society for Pediatric Endocrinology, and WPATH, and I forget who else was in it, been on that, published standards of treatment as well. So from my standpoint, I kind of have like two different standards that I look at. And those standards really state that, if a child is expressing concerns about their gender compared to their assigned sex at birth, that they are treated in an affirming, supportive, and loving way. And as they get older, that if that's something that's still ongoing, then that we can use puberty blockers to pause puberty, to allow them additional time to work on their gender. Doesn't sound quite right, because it's not like they need to necessarily work on it, but gives them time to ensure that their gender identity is consistent, And then as they get older, then affirming hormone therapy can be done as well. Those fall within the standards of care when it comes to what's published.
Puberty blocking therapy, Dr. Brown, is really a flashpoint for a lot of people, at least in the popular press. Your colleagues, how are they responding to that criticism in the public sphere?
Yeah, I mean, it's interesting to me that it is, as you say, such a flashpoint in that it's a reversible treatment. It doesn't cause anything permanent. It buys that child time. It buys the family time without any reversible changes being done. But it gives them time to talk with a therapist, consider their gender, work with their family. I guess maybe a better term is explore. What explore their gender? Because it's, again, as we said before, it's appropriate to explore gender. That's a normal part of development. And gender is not necessarily set. And it is something that people, as they go through their life, do explore and do consider. And so that's just a normal part of being a human. And this allows them time to explore their gender without attaining additional changes that may not align with their gender identity. And that can decrease the need for surgeries and other treatments in the future, and can allow them to present in their affirmed gender more easily, as they want to look. Not that we're forcing some look upon them, but as they want to look. And it can make a huge difference. And in these, early adolescent kids who are questioning their gender or exploring their gender, puberty can be so scary for them. Their body is changing in ways that don't align with them. And that's where we start seeing much higher rates of depression and anxiety, problems in school, behavioral concerns, because all of this is really just exploding in front of them. And when you can pause that and give them time to work through it, then you see those levels improve. You see their quality of life improve. And not every person who goes on puberty blockers goes on affirming hormone therapy. I've heard that said. It's not true. They don't all, but it gives them the time to explore and to work on that and to find what's the right path for them. Because again, they're the ones who know. We don't know. We can't force, and we should not try to force a path on them. We need to allow them to find their path and then support them on that.
Yeah, I was just going to say that those two societies and those guidelines are out there with very specific guidelines about treatment. But the American Academy of Pediatrics and Society for Adolescent Health also have policy statements supporting gender-affirming care. And that's really important. So again, they've looked at those guidelines and support treating young people.
We've included links to these documents that have been published by the various medical associations. You'll find them on our website, hearmenowpodcast.org. Bentley Moses, what do you make of all this?
I'm not a pediatrician or an adolescent medicine specialist, but speaking from, personal experience, I really appreciated what Dr. Drury Brown said about helping people find their path and giving them the time to find their path. Reflecting on some of the stories we were listening to, it can be really difficult for, children to get the footing that they need to understand and fully express their gender identity, because as kind of we heard with Sam and Evie, like there aren't always examples, or you don't always have. We have a world that's very modeled for a pretty binary set of examples, and so to put your true self forward, there are going to be people that might say things and treat you poorly. And we know that, based on how much we see, a lot of struggling from these people, from, the instances of suicidality and self-harm are really high in transgender populations. So to be able to express your true self and to have the time to do that, and the freedom to not have to experience aspects of puberty that maybe you're just not ready for, is very empowering. So I'm really grateful to, Dr. Dre Brown and Dr. Peck Prio, what you both do for this community, because it's just life-saving for people. And I don't think that you can underscore that enough, how life-saving it is to have access to healthcare that really allows you the space to breathe and be yourself.
I really appreciate you saying that. And beyond the healthcare community or setting, I think it's also true that there are other parts of the community that can be incredibly affirming. And there are examples of people who are providing a place of welcome and affirmation, and we shouldn't overlook their contribution to the good of children who are questioning their identity.
Absolutely. Your community is so important in helping you thrive. And we know that for children of any gender identity. And so organizations and groups and parents and aunties and cousins and family members and, systems and structures that are giving that positive support are life affirming. And we do that for children of all kinds. And so I'm just really grateful for the inclusion of transgender children, and they're just kids. Like, let them be kids and support them. So I have a lot of gratitude for those community members that really make it possible for children to thrive in those environments.
I want to play another excerpt for you. When we were thinking about how to structure this episode, one of the ideas that we settled on pretty early on was, let's invite a couple, two parents, to sit down and talk about the experience of parenting a young trans kid. And we stumbled upon Daniel and Karen Bogard, and I'm very glad that we did, because they tell a really incredible series of stories, and I want you to hear an excerpt from part of that.
What is your earliest memory, like having some inkling that maybe our child was genderqueer?
Well, I remember when we lived in our first home, and I remember cleaning out his older brother's closet. And I remember him going through the bin and pulling out his older brother's stuff. And I kept saying, you have your own clothes, you don't need his hand-me-downs. And that's what he wanted to wear. Yeah,
and he would have been all of, what, two, three? Yeah, that's my first memory, too, is him insisting from the moment he had any choice at all, really before he even was speaking in full sentences, that he wanted to wear boys' clothing, and in particular, boys' underwear. That always stood out because it's private, right? It's not like it's about your public presentation.
Right.
So my next memory, I don't know about you, I was putting him to bed one night. I was putting them all to bed and singing their songs. And he turned to me and said, "Daddy, do you think God could make me over again as a boy?"
Yeah.
And I remember going in and I remember telling you about that. And I remember us kind of laughing and saying, well, we are either going to always remember this conversation or it's going to end up being a no big deal, nothing of a conversation.
Yeah.
And I feel like it was at that point when things started accelerating a little bit.
I remember that conversation too.
So he came to us with a new name the day before lockdown.
March 13th.
March 13th. It was just 2 years. And he said the name to me, and the very first time I thought, my God, that name fits you better than the name we had originally given you.
And so we were home.
They finished that year of kindergarten on Zoom, and then for first grade, we're going back in person. And we were so utsy about the idea of the kids going to in-person school during COVID.
Yep.
That we never even called or contacted the school about the fact that he had transitioned genders and names.
I know.
Now, people knew, like the kindergarten teacher knew, the principal knew
his name
in
on
the system.
the enrollment.
But we never had a conversation with them. And the reality is we never needed to. That there was there has been no drama at school. There's been no drama with his friends. There's been no drama socially. They even, right, like in his first grade class, they threw a little party for him on the 1-year anniversary of his transition.
Yeah.
The rabbi, he goes to the Jewish school, the rabbi knit him a kippah, a head covering traditionally worn by men.
In trans colors.
In
the pink and blue and white.
Of the trans flag, right? I can't even say it without crying a little.
Yeah.
At our synagogue, he's been embraced and loved as who he is in a really drama-free way. But immediately it became clear that if we were going to love and support and affirm our trans kid, it meant we were going to have to defend him from our state legislators. Before we had told our parents, before we had told the school, before we had told anyone but really our immediate family at home, we had told the General Laws Committee of the Missouri House, because immediately it was clear that our government was at war with our family and with our child.
Picking on things that really aren't their business.
Yeah, right, exactly.
It's really like about him and our family and the decisions we make with our doctors and our medical providers, and it really has nothing to do with the state government.
There is a sense of evil that just seeps out of the place. And frankly, there's a sense of white Christian nationalism that is reinforced everywhere you go in that building.
We talk about separation of church and state, but I think we all know, especially now, that that's really not true. Because there's no reason why someone should go after children. People in general. I mean, it's awful. And we are all created equal in the image of God. And I believe that for my child, and I believe that for every person in this world, that we are created to be just exactly as we are.
Yeah, this notion of being B'Tselem Elohim, that all of us are images of the divine and reflections of perfection. It's incredibly powerful because it's a reminder that trans folk in their experience are sacred as well. There are stories which speak to the sacredness of trans folk, but also that just speak to the existence of trans folk. That there have always been trans people, that this has always been one of the expressions of what it means to be human.
That's Rabbi Daniel Bogard in conversation with Rabbi Karen Bogard, talking about their family and their advocacy work as parents of a trans child in the state of Missouri. You can hear more of the Bogard story on our website, hearmenowpodcast.org. What do you think of those two?
I was kind of speechless just listening to them talk about their kids and the school environment and going back to school and forgetting to mention that one big thing. I really enjoyed that one. Sounds like a very normal parent moment. But I was pleased for them that it was actually a smooth transition, because for many of my patients, it's actually a huge point of contention, being able to be called by your preferred name and your preferred pronoun, and to get it changed on rosters and roll calls, and how frustrating and sad it is for some of them, and difficult when they go to school and there's a substitute who misgenders them and calls them by the wrong name or pronoun, and it ruins their day. It makes it really tough to want to go to school and be at school. So it was nice to hear something different.
I just really appreciated him talking about how all of us, every human, right, is a reflection of the divine, of perfection. When I think about myself and my own life and who I am, I don't know that I feel like that I live up to that, to be a reflection of perfection. But that's there. It's there for all of us. And I wished everybody believed that we could all understand that every person is in the image of God. I really appreciate them calling out that there have been transgender people throughout humanities, and that we're all human, we're all that reflection, and we all deserve acknowledgement.
Agree. I mean, I think that was really, it's powerful and true and honest. And that, really stood out to me in like just affirmation of we all deserve to live as we are, and God intended us to live as we are. And I also love highlighting, we're not all perfect, and trans people are just people too. I love the like Dr. Peckprio was saying, how wonderful it was that they forgot to change the name at school, but there was not a problem. School was no big deal, and the community was fine with it. And it was just so normal, for lack of a better way, or just, typical and not, this is like going to sound dismissive, but not interesting, which in a funny way is like relieving. Like I get this huge sense of relief just hearing that story, like how nothing that experience was. And I wish that for everyone in this process, that you change the pronouns, it's simple and nothing, because it's a process sometimes, and it is exhausting to go through, regardless of how, where you are and who you are. And as a child, I think can be particularly difficult because your autonomy looks different. You are so connected to people in your life, and we're all connected to people in our life, but you're really dependent on people to help you in those systems in a way that maybe as adults we kind of forget. And that can be really challenging and exhausting, and you're just a kid. I love the normalcy of that, and juxtaposed against how extraordinary these two parents are, advocating at the state level and just really going all the way to support their child, and how much power and resilience it takes to do that and to step into that plate. And I'm so grateful they're doing that. And how wonderful would it be if they didn't have to, and it could just be mundane, and they could just forget to change the name, and it wouldn't be a big deal, and life would go on. I want that future.
Yeah, the joy of banality.
Yeah, it's relieving.
Yeah. The phrase that sticks in my soul is Rabbi Daniel saying that what seemed to be important for their son was wearing boys' underwear. And then he said, because it's hidden, it's not part of your external presentation. And I have reflected on that and thought, he's describing the behavior of a 3-year-old, right? And the wisdom of, like, I'm going to try this out. I'm going to give this a trial. I'm going to start with underwear and see where it goes from there. And there's something profoundly powerful about a 3-year-old having the insight to start small and see where it goes.
I also think in hearing that story too, it really affirmed for me that doing this it's for them. It's for that child. I'm doing this for me. I'm making this choice for me. It's not because I need the world to necessarily know something one way or another. I feel good this way. This is who I am, and I want to express myself authentically. And that's like so tied to what we were talking about of how do you know someone can know themselves that early? Nobody's going to see it. It's for them, and that is such a direct connection to expressing who you are.
We talk about gender-affirming care, and it's often seen as sort of something that comes at us extrinsically. Someone affirms us, and the Bogard son is sort of affirming himself. There's some self-affirmation that's going on there that I think shows real strength.
And kudos to the parents for allowing it too, right? For not saying, no, you have to wear this other underwear. Saying, okay, you can wear that underwear. That's fine.
Yeah.
It's, again, like we said earlier, Sean, that child knows their gender, and they say, my underwear should fit with my gender. I wear the right underwear.
And I would like it to have Power Rangers on it. Talk to me about conversations with parents, how you see your role in helping them understand what's going on with their kids.
Oh, that's a broad question. I see the gamut. I see parents who are fully supportive, bringing their child in, having had multiple conversations about gender and how they're doing, and they come in with an idea or a plan about what they want to do or want to seek more information about what they want to do, even if it is something as just simple to start with social transitioning, or if they are wanting to pursue a provider who can provide cross-hormone treatment. Again, most of my patients are a little bit past the beginning of puberty, so we don't necessarily always talk about puberty blockers. And then I've seen parents who really struggle with accepting where their child is and struggling with how to have a conversation with their child about it. And those are probably, I would say, the more difficult ones. And it's painful for everybody. It's painful for the child. It's painful for the parents because they're not on the same page. And that, I would say, is some of the most difficult conversations, is when they're not on the same page and can't get onto the same page. And I've had some parents who were really well-intentioned and thought they were doing the right thing, but couldn't quite say, the right pronoun. And I've had parents call their child it. It was painful. It was really painful. Or the kid, and they thought it was gender neutral in their opinion, but it didn't come across that way to everybody else. And so, being able to have those conversations with parents without being judgy, to really kind of find out where they're coming from, and understanding why kids sometimes have a really hard time coming out to their parents. If they haven't come out to their parents, I will always ask the child first, the adolescent first, how do you think your mom will react, or your dad, or, your moms and dads, and they'll tell me, and we come up with different ideas about how to talk to them. And communication, I would say, is probably the biggest thing that we work on, is how do we talk to each other so we can hear each other and we can be respectful and have that space to explore. Because if I feel you're going to shut me down, that adolescent isn't going to talk. And then they're going to be stuck with all these feelings inside and sharing with everybody but the person they really should be talking to, who's their parent. So I actually would be very curious to see how many adolescents, kids, come out to their friends first before they approach their family. I would fathom that it's actually quite a large percent. It's safe. I get to explore there. My friends accept me for who I am, so I'm going to explore.
Yeah, I was going to say, one of the questions that I ask almost all parents when I'm seeing a new patient is, were you surprised when your child talked to you about this? Because it's an easy way to get a sense of what they were thinking at the time. And some parents were completely not surprised. They saw it coming, they knew. And some were floored and didn't see it coming at all and had no idea. And so it gives me a way of kind of finding out where the parents are at, how are they doing, by just, kind of a simple question. I think one of the things that I try to do with all parents, no matter how easy the news was for them, is just to validate their experience. I think that's really important. These parents love their kids, right? They want what's best for their child. Sometimes they've got a ways to go. And it's a lot of learning for a lot of them. And sometimes there are, cultural backgrounds or family backgrounds that, they're worried about. But they all love their child. They all love their children and really want what's best for them. And so I like to be able to connect with them at that level, let them understand that I value them as a parent and for the love they have for their child. And I'm here to help them as well. The child is my patient or the adolescent is my patient. But I think it's so important to develop that relationship with the parent as well, so you can really build toward a common goal and get them there. And some are already there when they come, and some have a ways to go. But It's good to be able to validate their experience, acknowledge that they may be going through a grieving experience. It really can change the projected life trajectory of their child. It doesn't mean it's worse. It's just different, and they have to adjust to that. And I've had many patients where over years of being with them, they've made that adjustment and they can see all these benefits where they're at now. But initially, there's a grieving process, and that's okay. And for the most part, I would say, usually these are like adolescent patients where they kind of get that. They can understand a little bit of that, and you can talk to them about that and say, I know where you're at, and you've been thinking about this for a long time, and yeah, maybe you came out to your friends a year ago even, and now your parents know, and here's kind of what they're going through, and they can understand that. They still want them to get along and to come along some more, but they can understand that too. And I think just being able to acknowledge some of that and talk about it and allow for that can be really helpful, and help move the entire process forward too.
I really appreciate, the way that both of you kind of highlighted affirming, the patient's experience and also the parent's experience. Change is hard. It's hard for everyone. And this is something that I think that challenges a lot of people's perceptions and expectations. And there's certainly the process that you're going to go through medically, but there's the process that you're going to go through with your community and socially and interpersonally, and having those conversations and validating all of the feelings that go with that, I think are just as important as providing people with the tools for the specific medical care that they want. So I just want to emphasize kind of what you each shared about going through those conversations with patients themselves, and also with the families and the parents who are maybe at different places, and I love underscoring, because I think this is just universally true. Parents love their children. They want the best for their children. And sometimes when you are going through that process with a transgender patient, it's a new thing, and it's totally different, and it's change in a way that some parents maybe are a little more prepared to walk through that, and some might need some more support, and that's wonderful. They still love their kids.
I don't quite know how to ask this question, and I'm going to ask all three of you to take a swing at it. It strikes me that some of the burden comes from outside of these kids. It's not some intrinsic problem with transitioning. It's what gets laid on them by society or by parents or by neighbors or by people at school, and that dealing with other people's reaction to them can be the hard part.
Especially when it's family. So a patient that I saw recently, the parents are very supportive, but the grandparents are not, and they've been uninvited to family events. There's a lot of hurt in that. And I would think as a child, it would be hard not to have to take some blame for that, right? As a kid, you're going to blame yourself for that. Not that they should. It's not that they're at fault. The grandparents have some work to do. But yeah, there are, that's just one example of so many where I feel like the child or the person almost gets blamed for the reaction of others, right? We teach our kids, or at least I'm trying to teach mine, you have control over your response to a situation. You can't control somebody else's response, but you have control over your response. And in many of those situations, I feel like there's blame to the child. Well, it's because you're trans, that X, Y, or Z. No, that's actually your decision.
Sort of a hallmark of abusive behavior, isn't it? That
exactly.
You made me hit you.
Yeah, it's because you're trans.
Yeah.
And I feel like I mean, so many parents are so worried about that as well, for like they want to be able to protect their children from those types of interactions and things. I think that's part of the concern that comes up is, how can I protect my child through this? And wanting to be able to keep them safe. Like you mentioned earlier, the rates of depression and suicide are higher in children and adolescents who are trans. And I have parents who come who are so worried about that, understandably, right? And so, they're just trying to do their best to be able to provide their child with a supportive environment and protect them from some of these external circumstances and situations and things to be able to keep them safe.
What can we do to protect kids?
So what studies have shown is the best way to help protect our kids is really having a supportive and loving, affirming family. And in children who have been affirmed and supportive by their family, when compared with sibling matches, they've had similar rates of depression and anxiety across families. And so having that affirming, supportive family is super helpful in helping to protect our kids. Now, if you have a child who's older and is depressed or has had anxiety, don't blame yourself as a parent. Like, life happens, but where are you at now and what can you do now? You can love your child, you can affirm your child, support them, and that makes a huge difference.
When you talk about gender dysphoria, are we talking about an individual's unhappiness with their situation, or are we talking about an individual dealing with negative sort of criticism, opprobrium, coming from outside of themselves? Or are both considered dysphoria?
I feel like it's both, to be honest. When a young person looks at themselves in the mirror and they don't see the body that they feel like they should be in, it's incredibly upsetting for them. And then when they go out into the world and they feel like they have to constantly state their gender, state their identity, justify themselves all the time, if they're worrying about passing as the gender they see themselves as, it feels invalidating every day, every moment. And it wears on them. So not only just internally, but externally, because the world around them doesn't see them the way that they feel. And it can be very wearing because they don't know when it's going to come. They don't know who's going to say it or misgender them. And it's a constant, everyday vigilance of like, who's going to say the right words or wrong words.
Yeah, I agree. I think it's both, and kind of those societal expectations for gender assignment for all of us are harmful for anyone. If you're cisgender, the stereotypes of like boys don't cry, or women should cook, things like that are harmful and externally invalidate cis people as well. And with trans youth and trans people in general, I think it's just amplified. You end up seeing it more presently. And in some of that, like that dysphoria certainly comes from, external forces, might come from internal forces. But let's say you don't have any internal dysphoria. Let's say you're very comfortable with your presentation and your body and who you are, and you're still trans. That's absolutely a path that someone could have. But the way that you're expressing yourself doesn't fit within those societal expectations for how someone might, go in a stereotypical male or female category. And so that external influence from outside is what could give you discomfort and fear. So it's both, and I think it's also along a spectrum for everyone, transgender people in particular. But I would argue that that's something that we can probably all relate to, feeling like there were expectations societally about us that didn't fit how we wanted to express ourselves, regardless of what our gender identity was. It doesn't feel good to be put into a box about how you're supposed to present or what a man or a woman is.
Right. I want to introduce you to one last storyteller for us during this episode. Vinny is an educator and trainer for LGBTQI plus healthcare. They talk about how they came to understand their gender identity.
I am a queer, non-binary, transgender person. And I first realized that I wasn't cisgender probably kindergarten. I can remember back that far just having this feeling of, I don't want to be a girl. I don't want to be a boy. Why do I have to be either? Why can't I be both? Why can't I go back and forth? But I didn't have the language for that. I grew up in the Deep South. I am originally from Georgia. And growing up, I didn't hear words like transgender or queer unless it was as an insult. Even things as simple as being gay, I didn't hear about that until probably my teen years, because no one talked about it. So growing up, I had these feelings, but I had no words for them. And on top of that, because I grew up in a very conservative household, very Catholic household, gender roles were firm. And I was assigned female at birth, so I was socialized as a girl. And if I deviated too far from that feminine, I was ostracized or punished because it wasn't acceptable. Like, you could be a tomboy, but there was a limit. And if you went over that, it was too much. I didn't know about transgender beyond, trash TV like Maury, where they'd have trans women come on and guess who's a man, guess who's a woman, or Law and Order SVU, where every transgender person was just a sex worker. I never had any positive, real examples of transgender people until I got to college, when a friend of mine was dating someone who was trans. That's when I started becoming curious. And then I kept learning, and I would read stories, I would watch videos of transgender people, and just without realizing it, I was relating to so much that was being said in all of these stories. And then I learned in my mid-20s about non-binary. And at first, I couldn't get it. I just thought that's just man and woman. No, that's the end of it. But then I started reading more and looking at it more. And one day my brain just clicked and it went, oh, that's what I've been feeling all of my life. I don't have to be one or the other. I can be both. I can be neither. I can slide back and forth. And it was just a moment of clarity. And at one point it was just, oh my God, I finally get it. But it was also, oh no, how do I tell people?
That's Vinny, who was speaking with their husband, Henry. You can hear more of their conversation on our website, hearmenowpodcast.org. So I want to turn to the three of you one last time before we wind things up and see, do you want to comment on Vinny? Do you want to offer sort of a takeaway for the hour?
I really appreciate Vinny sharing just how complex figuring out your identity can be. I am also a trans non-binary person, queer, and oh my gosh, this story resonates so much, and how exciting and inspiring it is to learn the things along the way, and then also how confusing and disheartening, and every time you get a piece of information you're like, okay, great, what do I do with this? How do I talk about this? There's a really great Netflix documentary from 2020 that Laverne Cox put on that is about transgender representation in media. And I think we've talked a little bit about this throughout the podcast, just what it looks like to have, because we get a lot of our identity from what we see around us and who's in our community and how things are represented in media. And I love that, Vinny sort of highlighted there's a lot of challenging representation in media about trans people, and that can be really disheartening when you are trying to explore yourself and understand yourself. And I'm really excited that that's changing. I'm thrilled that there's better representation coming out, and that I'm hoping that kids get different opportunities to see themselves, and that there's more language that has evolved and been brought forward. Granted, I'm sure that language existed hundreds, thousands of years ago, when we've lost it and we're finding it again. Trans people have been around for eons, like the rest of humanity. So I love, in closing, just kind of what Vinny brought up of, it's complex, it's a winding road, it's hard to be a person. And I think we all can relate to that. And, being a trans person it's complex, but also being a person is complex. And so I'm just happy that, people like Vinny can continue to share their story, and that we have providers like Dr. Jory Brown and Dr. Peck Prio holding people's hands and giving them the resources that they need to step forward on that journey, because it's really great to be yourself.
Yeah.
It feels good.
Bentley, I'm so glad you contributed that, and I'm so glad that you helped us put this podcast together. Thank you.
Oh, thank you so much.
Dr. Brown?
I still am almost speechless from Vinny. I just think, there's just a beauty in those words and an honesty in them that I think that we should all respect. As I think over our discussion and our talk today, I guess what I keep coming back to is that it is appropriate to trust the person who is telling us about their experience and who they are. They know themselves, and we can trust that. If you know yourself and can trust yourself, then you should be able to give that same trust to another person to be able to say who they are. And as each person is made in the image of God, they should all be respected and loved as well, and allowed to be themselves and be supported to be who they should be. And to bring a little science back into it, one thing we haven't mentioned yet is the study that just came out this past week that looked at a cohort of over 300 children 5 years after social transition, and 2.5% had gone back to their gender that was assigned at birth. But that means that 97.5% remained trans or were non-binary. And these kids, they know who they are, and they remain who they are. And it is appropriate to explore, and lots of children explore. And in allowing that exploration, there are some who will come back, and that's okay too. But we can trust these kids to tell us who they are and support them in that journey.
I don't know if it's because I'm a radio producer by training, but I'm always listening for echoes. And over the course of the last 6 months on this podcast, this notion of narrative medicine, trusting what the patient says about themselves, that the first job of the clinician is to listen to the patient. Trauma-informed care, don't ask, what's wrong with you, ask what's happened with you. Tell me your story. I think it's one of the reasons why we wanted to produce this episode, because we realized there's power in that storytelling, and those stories that the three of you have been telling us, but also in the stories that we pre-recorded and that are sitting in a longer format on our website. I mean, these conversations go on for 30 or 40 minutes, and I really encourage people to dig in. Bentley, you mentioned, there were ancient names for the variety of human existences. That's something the Bogarts talk about, and how Hebrew scripture contains all sorts of examples of the presence of trans people in the community. It's fascinating. And I'm really glad that they participated in this. Dr. Peck-Preo, I'm going to give you the last word.
Thank you, Sean. Just really quick, going back to Vinny's story, I think what I took away from that was actually at the end of how grounded Vinny sounded, how self-assured, how confident Vinny sounded, and that it did take a while to explore and figure out who Vinny was. And my parting words for parents and kids and teens is have those conversations. It's not easy. Parents didn't come with an instruction book. Kids did not come with an instruction book. And so it takes a little bit of trial and error to figure out how to talk to each other about something that can be divisive or difficult, but also bonding at the same time. And when kids share something with parents they feel is important, there's a level of trust that's implicit in that discussion. And that trust is there. And if you're listening, you'll build on that trust. If fear, anger, or other negative emotions come into play, grief, sometimes it's hard to listen, and that trust is vulnerable then. And we want to keep those roads of communication open with our children so that they can talk to us during this journey, which can take a very long time to figure out who we are. We all are still figuring out who we are, so that journey never ends. I'm just going to say that. Having those open lines of communication and talking about it, even if you don't always agree, helps build competent children who are self-assured, who are grounded, who feel like they have a sense of control in their life when there's so much out of control in their life. And parents then can also role model problem-solving skills, communication skills, but also kids can learn how to practice coping skills with their parents because they're the safe ones. That's why we lash out at our parents, is because they unconditionally love us, theoretically, and we try again. So I just kind of put that out there for parents and kids, is just to try to keep those roads of communication open.
I want to thank all three of you for committing this time to the conversation. I'm so grateful. Thank you.
Thank you.
Thank you.
Thank you, Sean.
Panrat Peck-Preo is a pediatrician focusing on adolescent health at the Providence Medical Group in Spokane, Washington. Marcy Drury-Brown is a pediatric endocrinologist at Providence St. Vincent Medical Center in Portland, Oregon. And Bentley Moses is the Senior Program Manager for the Providence Institute for Human Caring's Trans Plus Health Initiative. Huge thanks to everyone who told their story for this podcast episode. Erin Pelger and her son Sam, Evie and her mom Holly, Rabbis Karen and Daniel Bogard, and Vinnie Fox. You'll find extended versions of all of those conversations and a half dozen additional stories about gender-affirming healthcare on our website, hearmenowpodcast.org. These stories are being archived at the American Folklife Center at the Library of Congress. Don't forget, we've collected a lot of resources for you on our website with information for clinicians, parents, and individuals wanting to learn more about Trans Plus healthcare. Just point your web browser to hearmenowpodcast, all one word, .org. The Hear Me Now podcast is a production of the Providence Institute for Human Caring. Connect with us on Twitter, where we're human_caring. The program is produced by Scott Acord and Melody Fawcett. We have research help from medical librarians Amanda Schwartz, Seema Bhakta, Sarah Viscuso, Catherine Gibbs, Carrie Grinstead, and Heather Martin. Our theme music was written by Roger Neal. The executive producer is Michael Drummond. I'm Sean Collins. Thanks so much for listening. Be well.